Merry Christmas, Mano. I'm Manoran living here in Canada. And if you're watching this video, you're torn between taking CELBAN or IELTS. Let me give you some ideas about the difference of the two. Una, i-define muna natin ang CELBAN at IELTS. CELBAN is Canadian English Language Benchmark Assessment for Nurses, while the IELTS is International English Language Testing System. So, CELBAN is for nurses only, while the IELTS is for the general public. IELTS has two types, the general training and the academic. General training is for immigration purposes, and the academic is for the professionals like nurses, doctors, pharmacists, medical technologists, and other professionals that would like to seek opportunity to English-speaking countries like Canada, US, Australia, etc. So, ang IELTS at CELBAN, itetest nila yung knowledge mo sa English in listening, speaking, writing, and reading. So, let us differentiate kung anong pinagkaiba nila sa bawat subtest. Sa listening part, i-compare ko ang CELBAN at ang IELTS. Ang CELBAN is 30 to 45 minutes, while ang IELTS is 30 minutes. Both of the exam, they will give you test questionnaires. In the test questionnaires, you will read the questions, and sometimes it's a multiple choice, fill in the blanks, and I'll give you an advice. You're allowed to read the questionnaires. Make sure na you read the questionnaire, you understand what they're asking. Kasi mas alam mong hanapin ang sagot pag alam mo yung tanong. Rather than makikinig ka muna bago mo hanapin yung sagot. So dapat alam mo na muna yung tanong at alam mo yung possible na sagot habang nagli-listen ka. So mas madali para sa'yo. Yun yung similarity nila. In listening, in IELTS and CELBAN, you have to make sure that you're familiar with the question and you're familiar with the possible answer. In CELBAN, may audio and video presentation of nurses talking to the patient, nurses talking to colleagues, or nurses talking to a doctor. Sometimes they will give situation like shift report, assessment of the patient, or charting. So basically, sa listening sa CELBAN, if you are nurse and practicing your profession in your entire career, mas madali para sa'yo. Kasi everyday mo siyang ginagawa. While in IELTS naman, it's very vague. It's like a general type. It can be telephone conversation, like hotel reservation, like talking to a friend. Sometimes they will give you maps. Sometimes they will give you a diagram. And it is like a daily conversation. And when you're taking an IELTS, you have to make sure that you're very familiar with different accents because they might give you American accent, British accent, and the most difficult in my part is the Australian accent. Kasi sabihin mo, English lang naman yan, pare-pares lang. No, when you're time pressured, you have to make sure na kahit anong accent yung ibigay nila sa'yo, naiintindihan mo. Kasi may question ka na hanapin, iniintindi mo pa yung accent. So many tasks at one time. So make sure you practice hard. The tips with listening in both exams, there's so many resources now. YouTube, IELTS pa lang, napakadali na ng resources. Mag-practice ka lang 1 to 3 listening tasks in YouTube a day, mahahasa yung listening skills mo. Meron din namang resources ang CELBAN. Unlike IELTS, CELBAN listening resources, it's fewer than the IELTS. But the main thing is, if you're a nurse, like I've said, mas madali sa'yo siya kasi everyday mo siyang ginagawa. Before, when we did our test, hindi ganun kadaming resources sa CELBAN. But now, even CELBAN, marami na rin resources sa YouTube. But in IELTS, like I've said, kasi dahil international nga siya, at mas marami yung market. So, mas maraming resources makikita ka online. And make sure you condition your mind and your ears when to listen and what to listen. Mas madali para sa yung ipasa, CELBAN man o IELTS. Lalo na yung medyo bingi, kasi like me, medyo sometimes selective yung hearing ko. You have to make sure na condition yung mind mo, tsaka yung ears mo, and yung concentration mo buo habang nag-listen ka. And like I've said, yung accent, kailangan sanay ka makinig sa different accent. And in speaking, I'm gonna tackle kung ano naman yung pagkakaiba nila. In the speaking part, both CELBAN and IELTS will start in introduction. Mag-introduce ka ng sarili mo, kung ilang taon ka na, minsan tatanungin ka, are you married, or something like that. Hindi nila i-judge kung ano ka, or whatsoever, kung anong status mo. Like I've said, it's an English exam, so you'll be graded kung paano mo may deliver yung mga answer mo sa questions. And just a tip, you have to fake it until you make it. You have to be confident. Kahit hindi ka na confident, you have to fake it na confident ka. Kasi most of the time, if you have a good first impression, that will make good in your exam. That will somehow help you to get the proper grade. So, sa CELBAN, most of the question is like regarding nursing. Like, how long you've been a nurse, nursing challenges. The second part is like the demonstration, like talking to your patient, talking to your doctor, or explaining and doing health teaching. So, minsan, magkakaroon ka ng natural conversation with your patient. Minsan, your task will be giving health teaching regarding insulin injection to a newly diabetic patient. So, minsan, tayo mga nurse, mararattle tayo. Mas focus tayo sa nursing skills. So, hindi naman tayo graded sa nursing skills. Graded tayo kung tama ba yung grammar mo, kung tama ba yung context ng English mo. Kahit sabihin mo pa 200 units yung binigay mong insulin, hindi ka naman graded doon. Kung paano mo lang i-deliver siya, minsan lang challenging siya kasi kailangan ipa-explain pa sa'yo ng patient. Kasi nga, yun yung mga challenge na kailangan makita ng examiner kung kaya mo bang mag-deliver ng English sa mga patient na kahit papano o most of the time hindi nila alam yung mga ini-explain mo. This is the first time na they gonna do it. So you have to explain to them na dapat naiintindihan nila. Yun yung karaniwan na test ng CELBAN. Or sometimes naman, conversation with a doctor. You have to report yung assessment mo. You have to report what happened to the patient. And you have to ask for an order. Sometimes, ganun yung test too. So, like I've said, it will be very easy sa mga nurses na nagpa-practice na. Kasi, para na lang siyang everyday life na ginagawa mo. You have to make sure lang yung mga grammar mo ayos. Kung paano mo sabihin ayos. Kasi, minsan tayo mga Pinoy, I can only speak for myself. Minsan, mahina ako sa grammar, ganon. While the IELTS part naman, speaking is divided into 3. Like I've said, una, introduction. Sometimes they will ask about if you're a student, if you're a worker. Sometimes they will ask about your hometown. Sometimes they will ask about your hobby. And then the second part, they will give you a paper. And on that paper, there's a topic and corresponding questions. Sometimes the topic will be like arts, kung kailan ka huli nakapunta sa museum, ano yung huli mo nakita. And then the third part is the question and answer portion dun sa interviewer based on the topic that they gave you on the second part. Mas in-depth nilang tatanungin regarding arts, like the latest news, mga ganyan. So, minsan, hindi naman importante may idea ka. Sometimes, you have to make up. Halimbawa, hindi naman ibig sabihin nakapunta ka na sa Paris. Pero minsan, sasabihin mo nakapunta ka sa Paris. You have to make sure na you're believable. Kasi gigrade lang naman nila yung English mo doon. And this part, you have to fake it until you make it. Hindi ka naman nila i-judge kung nagsinungaling ka regarding sa art, regarding do sa place na na-visit mo, or regarding do sa current event. Kasi, minsan, kailangan lang nilang malaman kung paano mo i-construct yung English mo. Lagi mong tatandaan na, doon naman ako ginigradean, hindi naman ako ginigradean base sa art na nakita ko. So, you have to fake it until you make it na kahit invento mo lang siya. Kasi minsan, wala ka naman alam sa art. Minsan, wala ka alam sa flowers. Kasi minsan, bawa, lalaki ka, wala ka naman alam sa flowers. Hindi ka nga nagbibigay ng flowers sa asawa mo, sa girlfriend mo. Pag natanong ka regarding flowers, you don't have any idea. Fake it until you make it, or you just have to read. In IELTS, you just have to read like current events. You just have to make an idea. Kasi nga, napaka-vague, napaka-broad niya, napaka-generalized. So, kahit anong questions, pwede nila itanong sa'yo. So, you just have to be articulate. And here we go to the least favorite of everybody, the writing part. In writing, both of the exam is divided in 2 parts. In CELBAN, the first part is like a report. I'm not saying all the times. Sometimes they'll give you an incident and you have to make an incident report. Most of the time it's like an incident report. And then, the second part, the topic in CELBAN, hindi naman siya malalayo sa halimbawa, nursing innovation, science innovation, nursing dilemma, like nursing shortage. You know this type of topics. So, kahit pa paano may idea ka, kailangan may explain yung insight mo. You have to write if you're in favor of it. Sometimes they will ask you to give advantage or disadvantage. Hindi naman i-gauge o hindi naman nila i-judge kung in favor ka or sa mga answer mo, i-gauge nila kung paano mo i-construct yung sentences mo. Sa IELTS naman, dahil akad tayo, ang first part nun, a pie chart, a line graph, or a diagram that you have to interpret. Meron dyang English and math at the same time. And the second part, you have to expand or you have to put your ideas. Like sometimes they will ask you like, are you in favor of paper money or plastic money? Give advantage and disadvantages. Your stand regarding paper money or plastic money. Like I've said, hindi naman nila i-judge kung anong stand mo. I-judge nila kung paano ka mag-write. Nakikita ko, most of the times, ito yung weak part ng mga Pinoy. Kasi mahirap naman talagang mag-write. Mahirap mag-write pag ikaw ay time pressure. Kasi sometimes, hindi naman lahat ng tao mabilis lumalabas yung mga idea. Minsan, pag time pressure pa nga, nararattle sila. So, ito yung nakikita ko. Minsan, nagkukulang sila ng 0.5 or something. Later in this video, I'll tackle that. In reading, you just have to read. Ito yung parang hindi ko na masyado i-explain. Ang i-explain ko lang is, in reading in CELBAN, most of the time is like problem solving of the patient, doctor. So, mas madali lang ang reading. While in IELTS, mahirap kasi ang reading sa IELTS kasi minsan ganito kahaba yung i-read mo and 5 questions sa ganitong kahaba. You have to make sure that you read the questions. And you don't have to read the entire paragraph kasi minsan you just have to read the question, understand the question, and you have to skim kung ano yung answer doon. Kasi baka maubos yung time mo sa read nun. Pag naubos yung time mo, meron ka pa palang 10 hindi na sasagutan. Better na mag-skim, scan. You don't have to read all of those kasi minsan sa kauunawa mo, mauubos na yung time mo. 10 question pa pala yung hindi mo nasasagutan. Yun lang yung tip ko. After the test, CELBAN will give you an official test result via email. They're gonna email you the test result and then later they will send the official result. The IELTS naman, you'll know the result because they're gonna send it to you based on the address that you provide them. And not everybody will pass. Lucky lang yung iba na nakukuha nila yung required score sa one take. But it's not the end of the world. You can reappeal in both exam. CELBAN man yan or IELTS, you can reappeal. In CELBAN, you can reappeal. Within 20 days that you received an official result in your email, you can reappeal. While in the IELTS, you have to reappeal within 6 weeks that you took the exam. So, you'll know the result after 2 weeks. So, you only have 4 weeks to reappeal. So, may corresponding fee yun. Sa CELBAN is $100. Pero pag naman, tumaas yung mark mo, i-refund nila yun. And then, sa IELTS naman is like $200. Pero pag tumaas yung score mo, i-refund nila yun. And the result of your appeal in CELBAN is within 15 days. And the IELTS is within 2 to 21 days. And disclaimer, I've seen some na nag-reappeal sila sa IELTS na tumaas naman yung grade nila at nabalik yung 200. And I've seen some na hindi naman nabago yung score nila tapos hindi nabalik yung 200 nila. So the question is, bakit ko i-release yung 200 ko kung 300 lang naman yung next exam? But, you know what? You have to risk. Minsan kasi, writing lang yung i-contest mo. If you believe that you wrote a very good piece, why not risk the $200? And worst case scenario, hindi lang naman mababalik yung 200 tapos hindi naman mababago yung score mo. Sa akin lang, you just have to weigh your option. But if you want to save money, like, I'll take the next IELTS, it's fine also. Okay, I'll give you tips naman kung ano ba ang dapat mong i-take. If you're here in Canada na and you're not able to pass the IELTS, you better try to take the CELBAN because it's for nurses. Mas madali siyang pasahan. Other people, bumagsak sila ng IELTS but nadalian sila sa CELBAN. But if you're a nurse in the Philippines that you are just weighing your option and you don't know what to take back, I advise to take the IELTS kasi if you pass the IELTS, you have the opportunity to go to different country unlike the CELBAN. Like, if you want to go to America, you can use your IELTS. Australia is using IELTS too. UK is using IELTS too. And even Canada is using IELTS. So if you pass the IELTS, there's so many doors that can open. If you're very good in writing and you're very articulate with your English, I recommend to take the IELTS and it's cheaper. My advice before taking an exam, you just have to research. You make sure that you're mentally and physically prepared for it. You have to make sure you practice writing and practice speaking with your coworkers, speaking with your family member. Kasi pag nag-speak ka, yung tongue mo, masasanay na sa English. Tsaka yung confidence level mo, nag-i-increase kung lagi ka nag-i-speak ng English rather than na hindi ka nag-i-speak. Mag-i-speak ka lang pag gusto mo o mag-i-speak ka lang pag magpa-practice ka. Pag alam mo na mag-i-exam ka, try to speak English every day. And writing, you have to make sure that you have a study buddy. Study buddy na alam mong very good in English, very good in grammar. He or she can proofread your work. Kasi minsan, akala mo perfect na yon pero pag pina-check mo, ang dami mo palang mali. Make sure na yung mga mali mo, nakita niya, is matatama mo na para ma-improve ka. Hindi yung ikaw or kung sino lang yung mag-check. And then, the listening part, like I've said, sa YouTube lang punta ka. Madami dong mga listening exercises. CELBAN man o IELTS man. And that's all it. Kung ano naman yung mga gusto nyong video in the future na gusto nyo malaman, just comment so I'll make a video. So please like and share this video, put a thumbs up and subscribe to our channel. This is my husband's channel but most of the time I watch his video and check yung mga comments so I'll answer. There you go. Have a good day.